Hello everyone, my name is Rabia Sarwar, MD. I am PGY3 Internal Medicine Resident at Skagit Valley Hospital, Internal Medicine Residency Program. Today I'm going to present my quality improvement project that I performed during the span of my residency at Skagit Valley Hospital, Internal Medicine Residency Program, a curriculum to increase resident scholarly activity. My co-resident, which helped me during this project, is Savannah Brodlick, who is PGY2, and my mentor for this project was Dr. Mary Ramsbottom. Resident participation in scholarly activity is an ACGME requirement for internal medicine residents. However, engaging residents in scholarly activity can be challenging. Most of us know that how busy the schedule is during residency, which is unlikely to change, so we sought to create a curriculum to educate residents about how to complete scholarly activity. By doing this, the hope was to help increase activity as well as provide a practical, efficient approach so it would not be perceived as such a time-consuming process. We did 3 interventions. The first intervention was that we conducted a 1-hour lecture and workshop each year focused on how to be involved in scholarly activities, case reports, and posters. I volunteered in teaching the junior residents how to write a case report, as I had done several of them myself. Then we used a pre- and post-intervention surveys to evaluate residents' attitudes about scholarly activity. This focused on figuring out what the barriers are to resident participation. The lecture and the subsequent year was then able to be customized better based on these responses. The results of the questions are illustrated in Table 1 and 2. As you can see, that a lot of the residents, although were able to identify the number of interesting cases for possible case report, but were not able to get the consent from the patients in a timely manner. Then a lot of the residents were able to draft the case report, but was not able to submit it in timely manner. Then our faculty helped us by arranging a spring scientific scholarship day where all residents were able to showcase their work. There were prizes for posters voted the best by those by the attending. Overall, our findings demonstrated that our interventions led to a dramatic increase in scholarly activity in our internal medicine residency program. As you can see, from year 2019 to 2020 academic year, the number of scholarly activities submitted were 21, which increased to 60 in year 2020 to 2021 and has been increasing this year as well. So we tracked the number of scholarly activities done by a residency program in the academic year prior to our interventions and found that 21 activities were done. The year our interventions were implemented, a total of 60 scholarly activities were completed, demonstrating a 286% increase in number of projects. So based on our quality improvement project results, we concluded that the interventions implemented were successful in increasing the amount of the scholarly activity in our program. Based on the degree of increase in activity, we hypothesized that more residents struggle with knowing how to go about research and case projects than one might anticipate. Based on one's backgrounds, there could be a huge range in the exposure of each resident has had. By presenting a practical how to approach to doing a project such as a case report, residents were able to have a reference for how to proceed. Ways to make the process more efficient was also emphasized. This included in identifying the features that make a patient case good for a case report, getting a consent early, and engaging a mentor. Our survey illustrated the areas where problems could arise, such as very few people obtaining consent, which led us to emphasize obtaining consent early whenever you see that there's an interesting case on the wards. Particularly, ACGME requires that residents present their research findings in an oral and written format. Scholarship Day among our own program allowed a more informal setting for residents to present their projects orally. This opportunity led to residents feeling more comfortable talking about their research. They were also able to see other residents and learn from each other. Methods. We plan to continue implementing the interventions we started, as well as continuing to come up with ways to increase the scholarly activity.